Welcome to Fast Physio Facts with me, Mick Hughes, episode number 6. And today we've got a big one, topic on manual therapy and its role in patients with patellofemoral pain syndrome. So a really nice meaty topic here. The paper that I'm reviewing here and breaking down is called The Efficacy of Adding Manual Therapy to Hip and Knee Exercises in Patients with Patellofemoral Pain Syndrome, a double-blinded randomized controlled trial by Abdo and colleagues, 2025. So they recruited 59 patients with patellofemoral pain aged 18 to 35 with symptoms lasting more than 4 weeks and pain greater than 3 out of 10. They randomized them into two groups, exercise only group, which had about 30 participants, and exercise group plus manual therapy, which had about 29 groups. The participants were young. They were about 22 years old on average at baseline, and demographics across the board were all very similar, and there were no differences between the groups with their basic demographic data. Now, when it came to the rehab that the exercise group, hip and quad strengthening group did was actually pretty decent. You could basically pick and choose, maybe a few things that didn't belong there. But I think as a whole, it was a well-rounded program that was conducted 3 times per week that was supervised for a period of 4 weeks. So 12 sessions in total, and each session lasted about 45 to 60 minutes. And the rehab got progressively harder each week over the 4-week period. If you are interested in what exercises were included and the sets and reps and all those kind of finer details, then this is a full free text paper, and the link is at the bottom underneath this video. So they included stretching, so they did calves and hamstrings, quads. They did some closed chain work, so mini squats to about 40 degrees to help the PFJ. Step-ups, lateral step-ups and terminal knee extensions. They also did some open chain work around the hip and open chain knee extensions. Now, the only difference between the groups was that the manual therapy group had an additional 5 minutes, approximately 5 minutes each session, looking at manual therapy and having manual therapy techniques performed to the knee structures around the knee each session per week over those 4-week periods. So that little bit of manual therapy added on. The authors looked at outcome measures, mostly looking at pain, and that's a really relevant outcome measure that we want to see improve over a period of time. They also looked at a functional score called the Kujala score for function. They also looked at hip and knee strength. They also looked at flexibility and a 30-second step-down test. So a pretty thorough paper. Now, the key findings are, and this is really of strong interest to us all, ultimately there was no differences between the groups. And impressively and importantly, both groups did improve. So that's a big thing. So both groups got better, but there were no differences between the groups. Pain, importantly, dropped substantially in both groups. So on stair ascent, so going upstairs, they used a VAS score, visual analog score, that ranges from 0 to 100. Now, the pain went down from about 50 to the low 20s in both groups. So approximate improvement about 54% in the exercise group, and closer to 60%, so 59% in the manual therapy group. But there was no differences in groups, even though there was a 5% change. On stair descent, so going downstairs, pain dropped from about 41 out of 100 to 18 in the exercise only group, and 38 down to 16 in the manual therapy group. Again, close to 60% improvement in pain. On squatting, the exercise only group improved from about 53 out of 100 pain to about 27 out of 100 pain, and manual therapy went from 64 down to 24 out of 100 pain. So big changes in pain all round. When it came to function, the Kujala scores improved, and we want to see increases of these numbers. So the Kujala scores improved from about 71 to 84 in the exercise group, about a 13-point change, and from 64 up to 84 in the manual therapy group at about a 17-point change. Strength improved across the board in hip abductors, external rotators, and knee extensors in both groups, but once again, no significant or meaningful differences between groups. Interestingly, the knee extensor group actually improved more in the exercise only group. So it's the one thing that was a clear difference across the board, is that the knee extensors, very important muscle group when we're looking at patellofemoral pain syndrome, they got better and significantly more stronger in the exercise only group. The manual therapy didn't add anything extra there. So look, ultimately a really interesting paper. It was a nice, neat and tidy paper. Of course, there's limitations here. There wasn't a control group. It was only a 4-week intervention. Would love to see longer term follow-ups, all these kind of little things that make a difference. But from a short and sweet study to a head-to-head comparison, exercise only versus exercise and manual therapy over a 4-week period, it's not a bad intervention. So what does it mean, I guess, for all of us? I think ultimately, we know hip and quad strengthening is consistently shown to be a nice duo when it comes to helping people with patellofemoral pain syndrome, and this study adds to that again. And does so in a really nice fashion in as little as 4 weeks. So that was really, really good, and that's something for us to all take away. I think for me, like the 45 minutes to 60 minutes of exercise sessions 3 times a week, for a young population, I get that that's probably doable and achievable. I would just question, someone that's maybe a bit older, a bit busier, that has, can't get to the physio 3 times a week and only can, dedicate 1 or 2, maybe 20 minutes to exercise per day. What would be their better bang for buck exercises? And is one exercise better? There was about 6 or 7 different exercises in this paper and in this trial. Was there 1 or 2 that were probably more superior than others to help these people pain? My gut is telling me knee extensions based on the improvement in their quad strength score, or some kind of squat variation or step up. That would be my only gut feel. There's no hard evidence to support that, but based on the improvements in knee extension strength, it makes sense that the quad targeted exercises were certainly important. Ultimately, when it comes to manual therapy, and I think this is always the big question, and it's always up for debate, and it's creating a lot of debate and conversations in the physiotherapy world. In this setting, in this instance, and the way manual therapy was applied in this population, it didn't have a tremendous benefit. It had no benefit at all in adding that extra 5 minutes to the person's physio session. So look, it's one of those things, if the person believes and expects there to be a change in their pain and helps with their function, and they're coming to see you and they expect physiotherapy, or they want it and they feel like it's helped them and it's worked for them in the past, sure, it's not doing any harm. It's adding a little bit of time to their treatment times. It helps with pain modulation a little bit. But we're not really clear on the significant role of it. And in this instance, if they are a person that hasn't really experienced manual therapy before, they don't necessarily believe they need it or want it, then we know quite comfortably that our exercise and progressive loading program is going to work a treat. So yeah, there's the paper. Feel free to dive into it a little bit more yourself if you want to have a deeper dive and learn a little bit more. But hopefully that's a nice rounded summary for you this time around for Fast Physio Facts. As always, thanks for the feedback, support, and questions. Stay tuned for more episodes in the future. And until next time, we'll see you then.